So we come across many of these intumescent white cataract in our clinical practice, and the biggest problem what we found in these white cataract is the capsular axis, because many times our capsular axis edge extends to the periphery and results into the capsular tear extension, which is normally called as a Argentinian flag sign. Why it happens? Because if you look at these white intumescent cataract, they have a very high intralenticular pressure, and the capsule is generally very tense and is stretched out and very fragile also. And the cortex is hyperhydrated and swollen. Cortical liquefaction would be there with multiple fluid pockets, and the nucleus is generally swollen and very large. So this makes the intralenticular pressure very high, and the capsule is stretched out. And what happens, like when we start the capsular axis, either we puncture with the 26 gauge needle or with the capsular axis forceps. So what these the fluid which is there inside the capsular bag erupts in a volcanic eruption kind of thing, like which includes the fluid. It's not only the fluid, it's the pressure which is there inside in the form of the gas or other pressure also. So that releases through this puncture. And many times what happens, like when you puncture the pressure which is there inside, the point where we have punctured the capsule starts extending to the periphery and results into a radial tear, and this tear is called as the Argentinian flag sign. Now, why it is important to know the Argentinian flag sign? Because almost 7 to 8% of the cases, this tear extends into the posterior capsule. And you know that the tear, if goes into the posterior capsule, the problems we can come across, we may have a nucleus drop and vitreous blob, and all these complications may come across. So because of the importance of this complexity of this situation, several techniques have been devised and published, and so many techniques are coming up, because some of these techniques, they work, some of them they don't work in all the cases. And some of the techniques which we all also practice is the mini rexes. We all know that we create a very small rexes in the center, and this rexes which is created in the capsule, then we release the intralenticular pressure through this. So this is what we have been practicing till now. This is how we make a small rexes and then evacuate the fluid and the material which is there inside, and decompress the bag and then start the capsular axis later on. And there are other techniques also which is called as a spiral rexes. I'm not going through all these. You all know that spiral rexes, 1 stage and 2 stage spiral rexes. And the most commonly practiced one is the small needle aspiration technique, where we introduce a 26 or 27 gauge needle, puncture the capsule, and then start aspirating the fluid out of the bag to decompress the bag. And what we have seen, like even with this technique also, the tear starts extending, and many a times. So it's actually the quotient of the pressure which is there, because in all the cases the capsular tear will not extend, but there are some cases where the capsular tear, the puncture will extend to the periphery into the radial tear. This is one of the case, like I've just punctured and nothing, because I haven't even started the capsular axis, and before I could do anything, the tear extend to the periphery. So these are the situations where nothing will work. Even the puncture, small needle aspiration, mini rexes, spiral rexes, nothing will work, because here the moment you puncture, the tear starts extending. So why it happens? Because you know that when we use the needle, that is the hypodermic needle, when we puncture the capsule, we are actually creating a radial cut in the capsule. So this is a linear cut which is made on the capsule. Whether we use the capsular axis forceps or 26 gauge needle, this is what happens. And then when you make the radial cut, and you know that the pressure is there inside, this radial cut easily opens up and start extending to the periphery. Now, as you can see, because there are 2 openings in the radial cut, the linear cut which is made, that opening starts opening. So this is why these procedures, they don't work in all the cases. And what we have done, we devised a device. This is called as the sieving needle microcapsulotomy, which has a tip which is like a sieving needle. It's a round and pointed tip, unlike the hypodermic needle. So when we puncture with this, so you make a hole in the capsule. So this hole, you know, that is the hole has a much better control force on the pressure which is there inside. So you can see the difference between the puncture which made with the microcapsulotomy and the needle. So if you have a hole, then this hole will actually resist the outburst of the pressure which is coming out of the capsular bag and will not extend to the periphery. There is no edge actually in the hole, so there is no question of extension of the tear. So, and through this hole we can decompress the bag, and then later on we can start the capsular access. This works in almost all the types of the intermittent cataract, type 1, type 2, type 3 and type 4 intermittent cataract, because even a small amount of the decompression of the pressure, whether in the form of the gas or the intralenticular pressure in the form of the fluid, so the capsular bag will decompress. You can do a little massage of the capsule to evacuate the fluid, and then can start the capsular access very easily. And this works in almost all the cases. I'm going to show now all these cases. And so this is what actually, so you know all these types of the intermittent cataract where we get this problem, and this is what I wanted to speak about. And very simple technique, and it doesn't cost you much, because you don't need any big instrument like Zepto and all, Femto and Zepto, because it is just 1 rupee needle. And this needle, like the sieving needle what we use at home for stitching the cloth, that needle can be used. There are 2 types of the needle available, steel and iron. So if you get an iron needle, you can bend the tip. You have to bend it 90 degree. And then when you go inside, the important point is the tip has to be very sharp. That is very important. It has to be sharp. A blunt tip will not penetrate, because the capsule is little elastic. So you need a very sharp tip to puncture it. If you have a non-sharp or blunt tip, then it will not puncture. It will rupture. So that is one thing. And then you have to keep it 90 degree. You don't keep it tilted. If you keep tilted, it may cut. You have to keep it 90 degree straight like this and puncture it. And you get a hole, and then you evacuate the fluid, and you can start the capsular access.
That is a new tip which you have given, that you can use that sewing needle.
Yeah, yeah, sieving needle, a simple sieving needle, it comes hardly 50 paisa needle. And otherwise, if you want the commercial model, then it's available with the Epsilon.
Epsilon.
So we have made 3 models are there. One model has a aspiration port also. You puncture and aspirate. The other one has just a puncture.
Wow.
So that can be very easily used, and I think many of the I've seen today also.
I've seen it has become very popular actually.
I've seen yesterday. I've seen the people presented this technique. I didn't know, like somebody is present. A lot of people presented this technique, and they've shown that this.
It has become very popular, and small things do matter actually.
Yeah, that's right. Because like he has done very beautiful work actually.
Yes.
And these are the things which should come up. Actually, in India, what is important is the commercial part is very important. See, actually, expensive machines are available, and all of us cannot have this femto and all, no?
Yes.
So what the person who's sitting in the rural area will do? So they should have a simple machine and cheaper machine, right?
That's a